try and try and try and try and fail. Only you know why it's 8 o'clock and he's not home. Out with his boys drinking, 'cause he knows when he goes home and opens that door, it's another night of fighting or silence. She's cutting up deep, and they just think that she's crazy, but you know better, doc. You know she's being touched in the wrong way. Oh, doctor, can you heal him? I pray, 'cause if you don't, he will not make it. Doctor, can you heal her? I pray, 'cause if you don't, she won't make it till the morning. Doctor, can you heal them? I pray, 'cause if you don't, they will not make it. Doctor, can you heal them? I pray, 'cause if you don't, they won't see the morning. Oh, 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 oh. Only you know how she feels inside. These feelings she's trying to hide, that's for another girl. It's not supposed to be. Only you know she prayed and prayed, how much she is afraid to get the help she needs, that your blood can set her free. Oh, only you know he's going to church but losing hope, 'cause he's tired of repenting for the same things over and over. It's almost over for him. Only you know I'm surrounded by broken people, and they need a hero 'cause they can't face what's wrong on the inside. Your boy's here to see them. Doctor, can you heal her? I pray, 'cause if you don't, she's not gonna make it. Doctor, can you heal her? I pray, yeah, 'cause if you don't, come, no, doctor, can you heal them? I pray, yeah, 'cause if you don't, no, doctor, can you heal them?
Live.
A warm welcome to everyone. Welcome to Heavenly Medicine. I am your host, Dr. Zayniah Louison, and it is a pleasure to be with you today. Okay, guys, so seeing as I have felt like I haven't seen you in a while, I'm just going to say a warm welcome to all our viewers, all the persons that are tuning in, whether it's on YouTube, Facebook, or even if you are driving in your vehicles on your way home. I just want to say a warm good evening to you all. Again, also a warm and heartfelt Happy New Year again to all of you. I just want to say thank you so much to all our viewers and supporters again. We are in the new year 2022, and you are listening to Heavenly Medicine. Okay, so today's topic would be diabetes type 2 and its effects. All right, so again, I know we had a beautiful Christmas. Some of us, we would have enjoyed time with friends and family. We would have had many to eat, some may not. What I would like us to do, I'm going to take a challenge. I know some of us also told me they are still continuing their Esther Adorning Challenge. Remember from our episode, I think would have been number 2, we talked about the Esther Adorning Challenge, where we are going to have a greater outlook on our health, where we are going to take care of our mental health, our social health, physical health, emotional health. Okay, guys. Also, we talked about the different ways that we are going to do so. So for this new year 2022, I hope many of you are continuing with the Esther Challenge, and it would be great if you also can share with us, whether via YouTube, Facebook, or even WhatsApp us. as to what are some of the ways that you have improved on your health or lifestyles. What are some of your New Year's resolutions that you have done either individually or as a family to improve your lifestyle, either eating habits or whether it's a change from sedentary lifestyle to more of an active lifestyle. So I'm asking you to feel free. Don't be afraid. You can call in or you can WhatsApp us and you can share some of the things that you have been doing to improve your lifestyle, improve either your diet, or what are the things you have incorporated in your family to improve your health. So again, just as a reminder, our topic today is type 2 diabetes and its effects. Okay, so I'm going to give callers some time to call in and they can share with us what are some of the things that they have been doing. Also, I would like to just send out a warm welcome, a warm good afternoon to all our viewers. We have some viewers that are always present. We just want to say good afternoon, and I hope that you would enjoy this evening's program. So we're just going to give you a little time so you can feel free to call in, all right, and share with us what are some of the things you have done. Okay, well, one of my challenges in the meantime, I can share. So I decided no Christmas ham. That was one of mine. And I decided to reduce on processed meats. Okay, so there was no Christmas ham. And I'm not going to lie, I did get a taste. All right, but I didn't do any of on my own. So I actually did, I said, you know what, no processed hams and also processed foods. So that's one of my challenges. So I don't know if anybody else would like to add some of the things that they had reduced from their diet, even though it was a merry time. Feel free to message, feel free to share with us, and you can call in and just share. The doors are open. We're waiting to hear from you. Okay, so while we wait, again, callers, the number is for 403-1031. So you can WhatsApp us or you can directly call. Again, you can also share your comments on YouTube, Facebook as well. So while we wait, I would just like to define diabetes. Now, we're not going to go into it and make it so complicated. I will try my best this evening to simplify everything for us. Now, I'm sure any one of us will say we have either a friend or a family member or someone that we know that is suffering from diabetes. Now, the colloquial term would be, as we know, is sugar. So sometimes not everybody would be able to know that, okay, yes, it's called diabetes mellitus. All right. But once you hear the term sugar, most people are aware as to what we are talking about. Okay, so I'm just going to define diabetes mellitus for us. So it is actually a metabolic disorder that is characterized by chronic hypoglycemia. So guys, when we're speaking about hypoglycemia, we're actually talking about increased blood sugar. The concentration in the blood is high. So there should be a natural amount of sugar that is in our body. Now, either when we have a meal, this sugar would increase in its concentration. Now, as naturally in our body, we have an organ, and this organ is called our pancreas. Now, this organ, what it does, it secretes something or an hormone called insulin. Now, this insulin, when we have a meal, this insulin, what it does, it actually will take up that sugar or glucose that's in the blood, and it brings it to the tissues where it is needed for energy. Now, in a case of diabetes mellitus, this chronic hypoglycemia or increased sugar is due to defects now of this same insulin that I've just mentioned. And sometimes it's a defect in the insulin secretion or in the insulin action. So sometimes there is no insulin, or the insulin that we have is no longer able to work as it should. Just to add a little statistics, so as in pertaining to the UK, United Kingdom population, currently over 4 to 6% of persons have diabetes. Now, worldwide, over 285 million people have been diagnosed with diabetes in the year of 2010. And it is predicted that it would exceed to over 400 million people by 2030. So we can clearly see that this is something that is affecting many of our lives, right? Now, why I decided that type 2 diabetes will be of most important to us is because it is actually the one that is affecting most persons within our population. Okay, so again, just to define type 2 diabetes, it is characterized by both insulin resistance and pancreatic beta cell destruction. So again, as I mentioned, the pancreas is this organ that will secrete the insulin. Now, if these and the beta cells are the cells that will secrete the insulin. Now, if something is wrong with your beta cells, whether it is non-functioning or in terms of type 2 diabetes, where there is insulin resistance, we will say there is a dysfunction. All right, so just to add, all type 2 diabetics usually exhibit both decreased insulin secretion and increased insulin resistance. All right, so again, we're also waiting for callers to call in. Share with us, what are some of the things you have done lately? What are some of the things in terms of, even if you had a family member that has been diagnosed with type 2 diabetes, what were some of the lifestyle changes that you would have done to incorporate them in your festive Christmas season, whether it was maybe instead of making the sorrel too sweet, what have you done as a family? You know, one thing we have noticed is that most persons that are diagnosed with diabetes, usually they stand alone. So support from family is very necessary. Okay, sometimes, so we have to incorporate them and know that, you know what, guys, mommy has diabetes, daddy has diabetes, so this is what we're going to do together. Yes, we want to drink, you know, all the nice drinks and the champagne and so on, but what are we also going to do to help incorporate that person as a family member with our festive activities? Okay, so call in, let us know if you did anything at all. I know some of you did, so please feel free to share with us, because I know many persons have spoken to me and have told me of how many different ways they have been trying out different things, what they did with their ginger beer and so on. So please feel free to call. We're waiting to hear from you. We know you have amazing health ideas. All right. Okay, so moving forward. Now, I'm just going to ask a simple question. Any of you have been feeling lately either a sense of increased urination? Have you been feeling a sense of increased, the feel of what we will call hunger, or find yourself eating more often than usual? What about a feeling of weight loss? You have actually noticed that you're losing weight that are unintentional. Okay, again, I'm just gonna repeat that. Have you ever noticed something about yourself lately? A feeling of increased appetite, a feeling of always feeling thirsty even though you're not exercising? What about the feel of just always having to go to the bathroom? Not just increased in the frequency, but also in the amount. Anybody? Okay, guys, so what these can be, they are usually clinical manifestations of type 2 diabetes. Now, they're called the P's. Okay, they are the problematic P's in type 2 diabetes. So the medical term will be polyphagia, that's overeating, right? Polydipsia, all right, that is where is excessive thirst. And polyuria is where you will be urinating frequently. Okay, so these are some of the clinical manifestations we will see in type 2 diabetes. Now, some of these things might be present, guys, but it does not have to be actual type 2 diabetes. Again, it is wise to go to your physician, where you will do a full workup and these concerns will be addressed and a full assessment will be made before it is diagnosed. But these are some of our problematic P's that we would like to we will pay attention to, and they can actually be the result of diabetes mellitus. Okay, so in the case of someone that does not have these clinical manifestation, what we will say is that these other persons can be asymptomatic. So this person may not have the polyphagia, they may not have the polydipsia, they may not have the polyuria, but what would happen is that you may catch them on something like, somebody might say, you know what, I notice I'm having a lot of abscesses or recurrent abscesses under my armpit. Or someone might say, you know what, I noticed that I'm always having increased yeast infections, right? And minus sexual activities, okay? So it might be recurrent fungal infections. It might be, certain things, recurrent abscesses, recurrent infections. Now, these are things that will definitely raise a red flag to your physician, right? Whereas someone might just be asymptomatic and might just be caught. It might be just caught on a routine lab work, right? For instance, you had to do a job medical. These are the most common ones where you may have to do a job medical. And while doing the job medical, you notice that the physician will say, okay, Mr. Jones or Mrs. Jones, your blood sugar levels was somewhat elevated. We're somewhat concerned about this, and we would like to do further workup as to see whether this might be diabetes or not. And it's in those findings then you would be asked or addressed pertaining to the different clinical manifestations. All right. So just to add, I would like persons to know that type 2 diabetes is the most likely a result of both genetic and environmental factors. So yes, most times if family members, if your mom has it or your father has it, there is a great probability that it is within your family, it is within your genes. So the whole reason we're here on Heavenly Medicine is for us to attack those things early before they even start. All right. So if you notice that it's within your family line, this is what we're here for. We're here to actually prevent the actual progression or to prevent the onset of type 2 diabetes. So we're actually arresting it immediately before it even begins. Okay. So just to add, what are some of the risk factors of type 2 diabetes, guys? Come on, I know some of you are listening. Feel free to also send out your messages. What are some of the risk factors for type 2 diabetes? Okay, so one of the most common risk factors within our island, within our community, right? Whether we're talking about the Caribbean, whether we're talking about Europe, whether we're talking about Asia, Africa, one of the most important or the most leading risk factor is obesity. Okay? Obesity, guys, right? Also, just to add, a sedentary lifestyle. So when we say sedentary lifestyle, we're actually referring to persons that do not do much physical activity. All right. So sometimes a sedentary lifestyle is due to working at home or sometimes an office job, usually from 8 to 5. So pretty much you don't do much activities as exercise or so. All right. Or you're an IT tech. I'm not coming down on the profession, but I'm just saying that most of the times is where you have to sit. Most of the time. That would be a sedentary lifestyle with physical inactivity. So those are also risk factors that we can also look at that will contribute to type 2 diabetes. Now, we just mentioned genetics, like the family. Another thing is moms that once when you were pregnant, you were diagnosed with what we will call gestational diabetes. That's where diabetes was found or you were diagnosed with it while you were pregnant. All right. So what we have noticed is that most moms, after delivering the baby, even though they were diagnosed with gestational diabetes at the time during their pregnancy, somewhat the diabetes is not reversed. So what happens is that they continue taking tests and their blood sugars are elevated. So then eventually they are now diagnosed with type 2 diabetes. Again, as mentioned earlier, we have our family history of diabetes. Again, if mommy, daddy, or persons, your grandmom or so on would have had diabetes, that means this is an increased risk. So from the moment you are at the age of 30 and some of the your systems and so starts to slow down a little bit, that is when you have to work a little bit harder to prevent the onset of diabetes. Okay, again, persons as well that are hypertensive or have increased cholesterol levels also will be at increase of type 2 diabetes, guys. And last but not least, we know as we get older and there's increased age, these also will be a risk of type 2 diabetes. All right, so just to add, most of us we are Afro-Caribbean people, right? But I'm just going to add that certain ethnic groups, especially African American people, Afro-Caribbean people, Native Americans, Asians, Americans, and Pacific Islanders, these are the persons that are most affected by type 2 diabetes. Now, someone will say, how do I know that I have type 2 diabetes? What are some of the things that I need to look at? What are some of the things I need to pay attention to? Okay, when I go to my doctor, what is it I'm looking for? What is it he or she should say? Okay, so again, we already mentioned those things that make you symptomatic. We talked about the excessive thirst. We talked about the excessive hunger. We mentioned the excessive urination and so on, right? So this makes you symptomatic. So already you will be concerned, and this would then lead you to see a physician. Now, what would happen is that if that day you came in, you did not fast. Now, as we mentioned in our last episode, we talked a lot about fasting. So most persons who would have visited their physicians before would have some type of experience of the term a fasting blood sugar, right? Where you are asked to come in without eating. So that would be now your fasting. So that would be your fasting blood sugar, right? So now when you come to the physician, then either some blood is taken from you, all right, and your blood sugar is tested. Now, this is fasting. So based on your fasting, the doctor would be able to determine, all right, whether the blood sugar is high or low. But in the terms of diagnosis, it can be diagnosed simply by taking a random blood glucose level where it is sometimes greater than or equal to 200 milligrams per DL. Now, I don't want to confuse us, guys, as to the values. What I want us to pay attention to, some machines that we have, and I'm talking about the glucometer machines. Some of you have it at home. You would have used it on your grandparents, help your mom, dad, or so on. So you have a clear idea as to what I'm speaking of. Now, this glucometer, some, as you know, the values are usually within 8, 7, 9, 10, and the units is a millimole. Now here I'm talking about where the units are milligram per DL, and I'm just going to show you a little trick as to how you can convert the millimoles into the milligrams per DL. So let me just quickly go into as to how it's diagnosed. So as we were saying, it's a random blood sugar that's taken at the office. And once it's above 200 or equal to, this is now, you can be diagnosed along with being symptomatic. Whether you have the thirst, the polyuria, the weight loss, or even blurry vision. So just by that one random test, you can be diagnosed with diabetes mellitus. Okay, guys? Now, another option is where you are asymptomatic. You never had any issues, no issues with your eyes, no increased fungal infections, nothing. You pretty much feel well. You haven't noticed any weight loss. You think you're okay. All right, but you're worried based on let's say family, it's in your family lineage, so you want to take action. So how is it diagnosed for you? So usually it's where the test is done at 2 separate days. So there is another blood test that is called an HbA1c test. Okay, now if this value is greater than or equal to 6.5%, then that is already a tick as to you are within the diabetic range. Now, also, if you came into the doctor and you're asked to do a fasting blood sugar and it is greater than or equal to 126 milligrams per DL, that is also a tick for diabetes mellitus. Now, as mentioned before, these will be 2 separate days in which these tests will be positive for diabetes. Okay, a third test, also known as the 2-hour plasma glucose test. Now, this test is used via OGTT. Now, what it is where you are asked to take 75 grams of glucose, right? You would drink that. And after taking that, you have to wait for 2 hours. Now, after you wait for 2 hours, your blood sugar is then tested. And once the value is again greater than 200 milligrams per DL, then you are now diagnosed with diabetes mellitus. Okay, so a quick little tip I'd just like to share with you guys. So some of you, yes, have the machine. Many have told me, okay, we have the glucometer machine, but we do not know how to determine the difference between when mine is saying 10 mmol. Doc, what's that? Okay, whereas when I go to the doctor and I took a blood test, it showed 246, right? Okay, so a quick rule is that you multiply. I'm just going to give you a quick little you're going to multiply by 18, all right, with the one that is saying 10 millimoles. All right, so the one that is saying the 10 mmol, right, you're going to multiply that by 18, and what this is then going to be equivalent to the milligram per DL. So a person, when taking a test on their glucometer, your glucometer machine is actually calibrated to mmol, millimeter mole, and to change it to milligram per DL, for you to know, you multiply by 18. So therefore it would be what, 180? Yeah, that would be what your blood sugar level will be in terms of milligram per DL. Okay, so moving on. Again, guys, we're still waiting for your comments. We're still waiting for some of the persons who would have done their challenges. What have you been doing so far to improve your health? What are some of the alternative ways you would have done to enjoy, yes, your Christmas, but stay healthy? Okay. All right. So for persons who are wondering, though I am not diabetic, but what are some red flags that are areas that I could be pre-diabetic? Okay, so a pre-diabetic person would usually be within the range of someone that would have had taking a A1C test, right? And they are within the range of 5.7 to 6.4%. Okay, another thing, for instance, you would have taken a fasting blood glucose test and your values were between 100 milligram per DL to 125 milligram per DL. Another range for a pre-diabetic person would be after taking that OGTT test, right, the 75 grams of glucose, and then when you waited 2 hours after, your blood sugar test was within the range of 140 to 199 milligrams per DL. All right, so this now puts you in an area of pre-diabetes, and this is where we want to attack that. This is where we want to prevent the progression of you getting into diabetes type 2. Okay, all right. Another thing, persons that are usually at risk of diabetes type 2, usually hand in hand would have elevated blood pressures as well. So those persons, we usually try to make sure that your blood pressures are within normal range. And a target blood pressure, as according to the American College of Cardiology, right? American Heart Association, the guidelines, the goal is to maintain a blood pressure that is usually less than 130 over 80 milligrams of mercury. Okay, so most of the times what we find is that persons that are diabetic also are hypertensive. So we're actually fighting against two evils. Okay, guys. All right, so moving forward. Now, in the event that you are diagnosed with type 2 diabetes, we want to be able to, how do we take care of you? All right. Now, we're just talking about some of the general things that you will need to do in order to maintain your health, in order to maintain that good blood sugar level, in order to maintain whether it's eyesight, maintain proper health. There are some things that is necessary for diabetics. All right. I'm just going to name a few. Now, dental exam. All right, so I know from our previous episodes, we mentioned about the Esther adorning, right? And these are annual checkups, right? Whether you go to the dentist, you go to your general physician, you work on your mental health, you do certain activities, certain sports, things that will definitely help in reduce your stress levels. We mentioned all of those. Now, in the case of the diabetic, there are some things that are similar as well that is necessary. Okay, so some people might say, why dental exam? But dental exam is very necessary as in the case of a diabetic. And most times a diabetic is known as an immune compromised person. So they are an increased risk of infections as compared to a healthy patient or someone that does not have diabetes. Okay, so dental health is important. Now also an eye exam. And we are going to go into it a little further as we talk about the eyes. Also, you would like to do a urine test. Now, your physician would mention something called a renal profile test, right? This is a blood test, but you will be looking at your serum creatinine, your urea, and so on, because we want to see the function of the kidney. Is the kidney working okay? These are some of the things we want to look at, all right? Because it's important for a diabetic to know that their kidneys are working fine, okay? So we will also do what we call a urinary albumin to creatinine ratio test. Also, what is very important, but may seem trivial, but it's very important, guys, will be a foot exam, right? Now, this foot exam, we must use the monofilament testing. Now, again, for persons that are within a community that may not have a podontist or doctors that specialize in foot care, one of the ways that you can improve on your foot care is also when you go to do a pedicure or you go to persons, your in spas. It is really important that also the persons that do pedicures to definitely know some of your your health status. Okay, for instance, a diabetic, the chances a diabetic would bleed faster because of the weakening of the tissues on the feet. Okay, they may have callus, they may have bunions. All right, so what is important that that person knows. So while cleaning and filing, they're very careful in the way they actually manipulate and the way in which they clean the feet, because what we can have is rupture of the skin, rupture of the superficial tissue, and this can make matters worse and lead to ulcers. All right, so these are things that it is very important. And whenever you're going to do a pedicure or whatever you may be doing at the spa, it is really important to let your spa podontist or whoever know exactly your status. Okay, all right. So I'm just going to move in a little bit more into what we will call our clinical manifestations called diabetic neuropathy. Okay, hi. Okay, all right. Okay, so in terms of diabetic neuropathy, so diabetic neuropathy is the progressive loss of nerve fiber function as a result of diabetes. Now, I'm just going to simplify this. So when someone has diabetes, what is happening? There is an increased concentration of glucose in your blood. Now, this glucose cannot be removed. Picture we're in a bus terminal and there's a large concentration of people in the terminal, right? And there is no bus. We need a bus to get rid of all these persons that are in the terminal. But there are little to few buses, right? Some of the buses are going to come. They're going to take these persons and bring them to their destination. And that will be insulin, all right? Now, the persons in the terminal will be glucose. So I just want you to picture this, okay? Now, what happens is that these glucose, if we do not have a bus that will be able to pick up that glucose that's in the blood, that glucose find themselves wherever, all in the tissues, affecting our blood vessels. They're all around the nerves. And what they're doing, they're actually damaging the actual function of the nerve. So just to simplify this, it would actually cause some type of nerve dysfunction, right? And as a result, what we will have is something called diabetic neuropathy. All right. So the main thing is that there is a structural breakdown of the nerve. And this now would lead to, that's why we have a lot of persons that are diabetic will be talking about, I'm feeling this tingling in my hands. I'm feeling tingling in my feet. Sometimes I feel a warm sensation, like a burning sensation on my feet. Sometimes I feel like when I'm walking on like my nerves. All right. You have many patients will mention that or would talk about this. And the medical term would be like paresthesias. Also, they would talk about increased pain. When sometimes they walk in, they would feel this increased pain. These are sometimes neural pain. Now, also, some may say they just don't feel at all. And that is where now it leads to where the nerves are being damaged. So now we have what we call a decreased or loss of pain sensation. So you're not feeling any of the pain. You pretty much cannot tell. All right, which is very common in diabetics. Okay. Now, what is common as well is where persons will present with what we will call distally, or let's say proximally, weakness or loss of coordination. Now, as a result of walking sometimes on the feet, what happens if a diabetic does not wear proper insole or proper shoes? Now, as a result of that breakdown with the nerves and tissue, they're not aware. So sometimes what is happening, there is a damage of tissue or damage of the insole. And what we see is on the instep, this is my palm of my hands, but we see on the instep, so if this is my hands, this would have been the toes, and right here would be the paddings of your toes, right? Right at the base of your toes. And these are the pressure areas. So when they walk, these areas are usually affected. So you would see sometimes callus formation or hardened areas, right? Due to the excessive pressure that is applied on the feet. And as time goes by, if they're not wearing proper shoes or proper insole, what would happen, and this is what we really want to avoid, will be the formation of ulcers. Yeah. Okay. So you would find that even as the skin deteriorates or it breaks down, you'll see some of them have a certain way their walk has changed. They may have like toe scuffing. You'll see like the toes start to crimple up like this. All right. Or they would mention like frequent tripping and so on. And just to make it natural, right? Persons that are usually diabetic, guys, now when it has progressed in such a way, what I'm asking family members and other persons to pay attention to is that, remember, diabetes also affects the eyes, the kidney, our limbs. All right. So one of the things that is a challenge is that sometimes we will tell a diabetic, you know what, pay attention to your feet. Look for when there are cracks. Look for when there are splits. If you notice that a nail or so went into your shoes, pay attention to that. But remember, we just mentioned that there is a loss of sensation. So what is critical is that some diabetics would actually be, you're outside, you're in the garden, you're not wearing a boots or you're not wearing a proper shoes, and a nail may prick you and you're not even aware. So it is advised that family members or so, even if you may not be able to do it daily, but every other day, you also help make sure you pay attention to their feet. You help wash their feet. You look for any cracks within the toes. You look for any splits. You look for any, bruise or so, because you want to be able to attack it immediately. And if you notice that there's any ulcer formation, this person needs medical care immediately to be treated so that it does not progress into an ulcer. All right. So again, I just want to add, sometimes again, along with men, I know sometimes with men, men are the least to actually go to see a doctor. So most of the times when a gentleman appears to the physician, their state are a little bit more worse as compared to a woman. Now, for the men, I don't want to scare you, but I also would like you to know that in terms of being a diabetic, you definitely want to watch, and not just men alone, but you also want to be very careful with your alcohol intake. All right, the drinking of the beers, though, your social get-togethers, and so you can have, nothing's wrong with having a beer, but you also have to watch why. Now, beer has a high concentration of sugar. It's glucose. So if your glucose is not managed and you're not taking care of that, what would happen, there will be an increased glucose concentration in your body as you continue to drink 1 beer, 2 beer, 3 beers. And as a result, it will lead to further complications. Now, one of the complications for men will be impotence, right? Now, this may sound somewhat strange, but impotence is a common presentation, right, in diabetics due to that diabetic neuropathy, right? Remember, our nerves also works along with functioning, and if our nerves are damaged or destroyed, we will experience impotence. Also, erectile dysfunction. Now, this sounds like shocking for some men, but even so, besides diabetes, right, just over excessive drinking of alcohol also leads to erectile dysfunction. So most diabetics, and in the males, will complain about the erectile dysfunction. Some of them may even say, "Oh, doc, I think it's my blood pressure medication that's causing it." But if your sugar is not controlled, it also can lead to that as well, because you're also affecting the nerve that will give you that proper performance and functioning. All right, so just moving on, we also have persons that are affected with the eyes, and we're going to go a little bit more into that, where there is blurred vision. All right, so I'm not going to go into too much of it, but definitely that is also called diabetic retinopathy. Okay, so we're going to look into that a little bit further. Okay, so I just want us to keep in mind that it's not just, it affects both our kidneys, it affects our eyes, it affects the lower limb especially, right? And even though we may not see it, but most persons, they are immune compromised, and as a result, they have an increased risk of infections. All right, okay. So let's just look into diabetic retinopathy. Okay, again, this has to do with the eyes. Now, just to simplify it, this will cause blurry vision and eventually progressive progressive vision loss. Okay, so basically what would happen, you would have these infarcts in the eyes, and this is what they will call a cotton wool spots. So when your eye doctor does the test and evaluate your eyes, you would find that there are these micro infarcts, right, or what they will call cotton wool spots. Some persons would even tell you that they're having blurry visions and they can actually see as if there's spots there. Okay, so that as well is something that definitely needs to be dealt with, and these are when you get to a more later stage, you will find that. Now there's still hope, because this can be surgically repaired, all right, and improved along with change of lifestyle and diet, etc. All right. Again, so we talked about our retinopathy. We talked about the nerves, neuropathy. Okay. And what I just want us to just get into, just quickly, are simple ways in which it's called let's put it that way, it's called the silent MI. All right, so we talked about the destruction of the eyes. We talked about also the kidney. We talked about the limbs, right? But also as a result of this diabetic neuropathy and the loss of sensation, now, as we just mentioned, persons that are diabetic also sometimes find themselves hypertensive as well. Now, one of the risk factors will be what we call a myocardial infarction or a heart attack. Okay, so what happens, most diabetics, as a result of this decrease in sensation, they actually can have a heart attack that is called a silent MI without the actual excruciating pain to the chest. And that feeling, most diabetics may have a heart attack and actually may not feel it as how another person will feel it that is not diabetic. Okay, so again, the general treatment for diabetes type 2, usually we first start with oral hypoglycemic drugs, including metformin. There are so many others, but also if it progresses, then we will have to get into insulin. And as I always say, in heavenly medicine, our goal is to attack it very early or to prevent the actual onset of the disease. Now, I just want to mention to those persons that are diabetic, now we want to look into areas that instead of the hyperglycemia, which is an increase in the blood sugar, right? We want to look at areas where you are facing or experiencing hypoglycemia. Now, one would ask, what is hypoglycemia? All right. So hypoglycemia now is in a case where you have a decrease in blood glucose levels. All right. So for instance, you're taking your meds, right? And maybe that day you did not have breakfast, that day you did not, but somewhat you took the meds and maybe, or something happened and you forgot to eat or just something, but you definitely took your medication. Now, doing that, you put yourself at risk of being hypoglycemic, because remember, those medications are used to balance, right? And they work to help the pancreas secrete insulin and also for that insulin to take the glucose and bring it into the tissues. All right, that's the function of the medication. The function of insulin is if your body now no longer produces insulin, as we said, insulin use will then take up that function, because this will be a synthetic insulin. It will not be now an insulin that is produced by your body, but it will be a synthetic insulin, and it would aid in the same function of taking that blood sugar and bringing it back into the tissues and used for energy. All right. Now, in the event now you're in a situation where you're hypoglycemic, right? I'm just going to call out a few areas. Sometimes persons that are dieting, okay? Now, usually it's very hard, and I've heard and persons say that, doc, it's really hard for me to lose weight when I'm on insulin. Because think about it. Now, this is not for you to not use your insulin. Now, what happens is that if you have insulin that is allowing you to take in that sugar and bring it to the tissues, you're definitely going to be getting all your nutrients, and your body is going to be taking up that glucose, and eventually, if it's a lot of glucose, it would be stored as fat. All right. So you'll find that sometimes when a person who was in the early stage of diabetes, when it was not detected, was complaining of weight loss that was unintentional. But as the moment they begin to use the insulin, they then started to gain weight. All right. So now in the event that a person that is diabetic wish to diet or would like to lose weight, it is wise that what you can do as you diet, you look at the type of foods that you eat, right? So whether it's your vegetables, whether you're cutting down on your calorie intake, right? Now, as you cut down on your calorie intake, then what would happen eventually, the amount of insulin or the hypoglycemic agent that you are using, then the concentration of it will have to decrease. But keeping in mind that you're slowly working on it, right? You're not going to drastically decide, I'm going to fast and eat nothing. Now, this will lead to hypoglycemia. So you definitely want to speak with your general practitioner. You want to speak with your family doctor as to ways that you can be counseled as to how to diet, also being a diabetic. Now, in the event also that when you're exercising, all right, if you're planning to exercise, you also remember as you're exercising, you're burning glucose. So there's not going to be a lot of sugar in your blood. Now, when you do that with the exercise, again, you also want to decrease on your insulin intake or whatever concentration of your drug you are taking, whether it's metformin, glipizide, whatever it is, because as you exercise, even if you had something to eat, you remember you're burning energy, right? So you also need to be very careful with then taking that hypoglycemic agent, because that again can also cause hypoglycemia. I just want to also add, for persons that are usually traveling, I know sometimes it's difficult, but it's always good to have a medical report or something just that you can have a card or so saying that you are a diabetic and it is necessary for you to carry your insulin in a little pouch and you have it either with a little bit of ice, or it's always good to let them know, because as we travel, there are so many travel restrictions. So it's not wise to have your insulin in your carry-on or placed in the overhead cabinet or anything like that, where heat or so can actually change the composition of the insulin. So you want to be very wise with that, and even have a little card or so to let them know that I'm diabetic and I may need to have this with me so that I can take it whenever necessary, because some flights can be very long, so you have to be able to manage your flight duration. Make sure you have a snack with you, make sure you have something that you can eat, because you know that if you do not and you're still taking medication, that can also lead to a low blood sugar. And this, of course, can lead to you can pass out, and this is dangerous to you. Okay. Now, I want to add alcohol use. Now, many persons or I would say some persons may say, well, doc, I wasn't aware. But alcohol has a very high concentration or calorie concentration. It's actually glucose, it's sugar, all right? So the kilocalories from alcohol is usually 7 kilocalories. Yeah. So in terms of kilocalories, when we're looking at fats has the greatest amount of kilocalories. So fats will be like 9 kilocalories, whereas alcohol will be 7. Carbohydrates and protein will be then 4 kilocalories. All right. So alcohol, you may have one beer, but that beer may have such a high concentration of sugar, you actually might be surprised how quickly you would actually elevate your blood sugar level. Okay, so we need to be very careful as a diabetic when you're having alcohol or so. Nothing is wrong with a glass of wine, but we also need to be very careful with the beers and the different types of alcohol beverages. All right, so I'm just going to share a quick little PowerPoint with you guys. And as we look at the PowerPoint, I want us to focus on, now, these are just, I will call them alternative therapies, right? Now, these alternative therapies, again, I am advising they are not to be used along with your conventional medicine. These alternative therapies for us here on Heavenly Medicine, it's all about preventative measures. These are used to prevent the onset of diabetes type 2. Now, I'm not advising persons to be taking them along with conventional medicine when they are already diagnosed with diabetes type 2. Okay, but some of these agents I would like to share with you today. Okay, so their main goals, some of these alternative therapies are what we will call hypoglycemic agents, very similar to the medication. I know some persons are like, okay, doc, well, tell us, so here it is today. Okay, guys, so this quick little PowerPoint was, I know we had a wonderful Christmas. Some of us ate a lot, and we're trying to figure out, okay, now how am I going to work on this? So I'll just like to help you out with a little bit of what we can do to decrease our sugar level. And I know some of you are actually due for patient to that where you're going to your doctor, sorry. Okay, so I know some of you are due, so you're already ready, like, oh my god, I need to get myself together and so on. So here it goes. All right, so there's this plant that this has been researched by the Oxford Medical Association. All right, so this is called the crepe myrtle. Now, a lot of us within the Caribbean islands, now these are actually sometimes within our backyards. They're sometimes there either in grandma's pots or plants. They're there, but we pretty much we're not really aware of their benefits, right? Some of them may have it like it actually blooms really nice, and it's a nice lavender flower. So it's used like a flower. But this is what they call banaba. Okay, and it's called the crepe myrtle. All right, so this actually has some type of hypoglycemic effect, and what it does, it's like it has an insulin-like effect, right? And it works on the insulin receptors, and this actually helps decrease your blood sugar. Now, again, guys, I'm mentioning these as to the plants and so on that we have that can just reduce our blood sugar levels or maintain a proper blood sugar level. All right, so if you know you have some of those in your backyard, kudos to you, because you might be in luck, and you can use some of those. Another thing that I found to be so helpful, all right, this is called the bitter melon. Guys, I was so excited when I actually got a hold of this. Now, this bitter melon is usually common in certain places like Guyana, Suriname, and different countries like that. But it's also present in Grenada. Now, it might not be as common for some, but it actually is present, and it's pretty bitter. A lot of people, when preparing it, they either prepare it like with fish or salt fish to mix it so that you can get that nice bitter taste, but also savory with your usual dishes. So they actually eat it with the dishes, but it's very bitter. All right, and this bitter melon, it contains it has again an insulin-like effect, and they use it whether in savory dishes, they use it as juices, they create a powder for it, they actually can put it in their fried foods or so on. So what you find is that a lot of Asian communities, they use the bitter melon, right? And they actually may put it in fried foods, and so this is also something we can also incorporate in our diet, and this also helps reduce our blood sugar levels. All right, now what I found also interesting about the bitter melon, just to add, it's actually the sister to what we call the coolie popper. Right, and the coolie popper, which is most common to us, like some of us have it growing on our fence, in our backyard, and the coolie popper, I called it miracle plant, because I remember even being little, and anything, a matter of fact, that was on my skin, my mom would use that coolie popper on me and it actually worked, right? So here goes. So this is actually what we know to be the coolie popper, and it's actually a sister or cousin to the bitter melon. And some of you would actually see that little orange pod, and sometimes you suck it and it's pretty sweet, right? So this again does have insulin-like effects, and this reduces your blood sugar levels as well, just to add. Okay, so another plant again is called the fenugreek. And what happens with this fenugreek, it has these seeds, right? And it's actually the seeds, it's like a little flower, and when it dries, it actually releases these seeds. Now, these seeds can be grinded into a powder, and they also may enhance insulin release from the body, right? And what they do, it actually decreases carbohydrate absorption, right? Now, this has a laxative effect, so be very careful with this one, because then you would find yourself, you don't want to take this on a daily basis, or you may want to just try it on a weekend when you don't have to work or so. All right. The next one, just to add, it's called the Jemima. All right. And what it actually is, now the term Jemima or Germa, it's actually Hindi. And again, if you notice, remember we mentioned earlier that a lot of Asian communities have diabetes. It's usually common within those races. So a lot of their foods, they try to incorporate it with some of these plants to actually prevent the onset of diabetes. So this, in the Hindi culture, the term germa, it actually means sugar destroying. Right? And what it does, it actually increases the secretion of insulin from our pancreas. And this helps in reducing even our HbA1c blood sugar levels. And just to add, guys, the HbA1c blood test. Now, this test, what it does, it's a marker of our blood glucose levels for over 3 months. So it's not just, okay, well, you know what, today I'm going to drink some Jemima before I go to the doctor. You know, chances are when I do that, my blood sugar levels are going to be low. So I'm just going to bust your bubble, guys, because that HbA1c is actually going to tell us who has been naughty and who has been nice. Trust me, because it's actually a marker of what you've been doing for over 3 months. So then you will know, your doctor really knows if you're working on on your sugar levels or not. Okay. All right. So a next one, just to add, is called the berberine. Now, some of you would think this is common because I've seen this in Grenada before. I've actually seen this plant. All right. And what it is, this also helps lower your HbA1c as well. Now, again, these are all alternative methods of lowering your blood sugar levels, but they are not advised to be used along with actual medication. Okay. And we have our famous cinnamon. All right. And a lot of persons, I know some of you know of the cinnamon if you live with, elderly people or so. Cinnamon is one of the most common, and what makes cinnamon so nice is that it's actually really sweet. So what it is cinnamon is actually an insulin sensitizer. So it makes insulin really active. So let me just give you a little analogy. So it's like where you're in the bus terminal, as we mentioned, and you have the buses that are insulin, right? So long ago, well, I guess all buses now are good buses, I guess, right? So long ago, you would have what we call the bad bus, them buses and them that would be playing all the good music and they drive in fast, so you're getting home quickly. All right. So this is what cinnamon does. It actually sensitizes, it's like makes the insulin more active, and it makes the insulin pick up the people quicker and move into the tissues really faster. So that is what really insulin does. And what makes insulin really nice, it's not bitter, it's actually sweet. So sometimes you just actually have a little cup of cinnamon, you drop it into your cup with hot water, and what you find is that you actually have a really nice spice tea, and it also helps in lowering your blood sugar levels. So it's pretty nice, and it's actually used again in many Asian communities like the Chinese, and so they use it a lot. All right. So, and it's very safe than compared to some of the other plants. All right. So I think for me, the cinnamon is the winner for me. Okay. And just to add, guys, we also have like chromium. Now, chromium can be a supplement that is usually added to your diet. Now, the benefits of chromium is in the event that you have a chromium deficiency. Now, some people don't really know whether they have a chromium deficiency. They'll be like, well, how would I know? All right. So one thing we can do, there are certain tests you can test to see whether you have a chromium deficiency. But it's also important that persons that have an increased family risk of diabetes, it's advised to sometimes take a supplement, a chromium supplement, right? And what chromium does, it improves the insulin sensitivity. Okay, so it's very important that any chromium deficiency is then corrected, and this would help in actually improving your glucose levels. Yeah. All right. And just one more thing, another supplement we have is vanadium, but again, vanadium also is thought to stimulate the hepatic glycogenolysis. So what it does, right? Instead of the liver producing this glucose, right, it breaks down glucose. All right, so that's what it does. And it prevents the liver from actually producing new glucose, and it aids in the actual breakdown of glucose. It prevents that uptake of glucose. So it actually helps in, instead of our body actually having this set of glucose all around the place. So it actually decreases in that, right? And instead of the formation of glucose, it prevents that. Okay, so it's really important to check on these different your chromium levels and your vanadium levels. All right. But at the same time, when taking these supplements, we also want to ensure that our kidneys is working very fine. Okay. All right. Now, just to add from our other alternatives, ginseng as well is also important. There is something called prickly pear cactus that is also important. But you know, at the end of the day, those were the most common ones that we also can use as well. All right, so I'm just going to go back to the PowerPoint, and for those of you that are still asking, as in case of the what are some of the foods that are rich in chromium, because I noticed some people are interested in that, I'm just going to quickly share that broccoli, our general broccoli that we eat, this is rich in chromium. So if you don't want to take a supplement, you can also increase your intake on broccoli. Corn, right? So some persons that like corn actually increases your chromium levels. Oats, general oats, sweet potatoes, yeah, sweet potatoes, green bananas as well, like our green bananas that we eat, tomatoes, grape juice, and orange juice. Those also increase your chromium levels as well. All right. So now, one of the things that a lot of diabetics has been complaining about is they would say, you know what, doc, since I've been diagnosed with this, or even before, I've noticed that I've lost appetite, or every time when I try to eat, I feel like I'm already full. Okay. So I don't know if some of you can attest to that. So now this term is called gastroparesis, right? And really what it is, now is really interesting, okay? Because as we eat, the food enters the esophagus, it then goes into the stomach where it's mixed with all the gastric juices and so on. But what happens is that it is where it has some, as a result of a damaging of the vagus nerve, right? Now, remember, diabetes affects the nerve. And as a result, this nerve is affected. It's what we will call a delayed gastric emptying. So the food stays in the stomach very long. The nerve doesn't allow the nice peristalsis actions to take place, the churning and so on of the food to take place. So as the diabetes or the nerve injury increases, now this would lead to a loss of muscles. Our food is not being broken down properly. The nerves are damaged. The food will stay a very long time in the stomach, causing a lot of gas. A lot of you would hear, we call our stomach starts to make a lot of noise. And in terms of the peristalsis area, we would have what we call it's closed, and that has to do with a what we will call nerve damage, right? Or neuronal damage. Okay, so that is why you're actually be having this gastroparesis. And again, at that time, if you take a finger stick test, most of the time your sugar is usually elevated. All right, so you would have that feeling of fullness even though you haven't had a full meal. Okay. All right, so we're moving on to the diabetic foot. So even we mentioned the diabetic foot before, and I talked about where the sugar is just there, it's all over, it's affecting, it's actually going to tag itself or attach itself to the blood vessels, it's going to attach itself to the nerves, right? So what happens is that we're going to have reduced blood flow. It's affecting our blood vessels, it's damaging our nerves. Right now we're losing sensation, we cannot feel. Sometimes, if for instance if someone prick you with a pin, you may not be able to feel, so you know that is something that is we really need to deal with. And again, now this is when we get into a progressive diabetes. This is when it's worsening. Okay, so sometimes if for instance you have these bunions, you have these ingrown toenails and so cracks, calluses, what happens is that if they are not attended to or they're not addressed properly, as you continue to walk on those pressure areas, as I mentioned earlier, these would then lead to ulcers. So we really want to be careful. And most times I would say a diabetic, you really want to take care of your feet very carefully. You want to make sure you have shoes that have a good insole. Even if the shoes does not come with a proper insole, you can always buy one, because you want to cushion your feet very well. You want to be able to walk comfortably without feeling as if your foot is actually barefooted. Yeah? Okay. And again, when going to the spa and so, you always let them know of your medical status. You know what? I'm diabetic. So even when they're working on that ingrown toenail, they're actually being very gentle. They're not trying to dig in too much of the flesh. They're not trying to remove too much of the callus, because again, with a diabetic, the skin is very weak and it's easy to rupture, right? And as a result, it can lead to an ulcer. All right, so in taking care of a diabetic, now guys, and also family members, I just want you to just keep in mind as well, if it's progressive diabetes and it has now been long standing, most patients would have issues with their eyes. So sometimes it's good sometimes to just help out a little bit, help wash their feet. When you're washing their feet, you also want to dry it well. You want to prevent any type of fungus or any growth between the toes or within the nails. You want to prevent any type of fungus. You want to check for if there's any temperature changes or any type of swelling. You definitely want to look between the toes again, or the toenails. When filing the toes, you want to make sure you file it very neatly and across. You don't want to file it horizontal or diagonal to have any like pointy like a knife, because again, that could actually puncture or bruise the other toes, right? The toes next to it. Okay, you want to check for any dry skin or any cracks. And then it's very good if you have, okay, this may sound like an exaggeration, but it's actually not. If you have a magnifying glass, guys, I would definitely advise you to get one. There's, you can always get them maybe in any toy store or any store. All right, it's good to get a magnifying glass, because remember, if you yourself is diabetic and you want to see what's going on with your feet, you may need a magnifying glass or something that just to view the feet bigger, so everything's visualized bigger. All right, and it's always good to track different things that you see, and if you notice that something has progressed, you definitely would want to see your physician. All right, and the diabetic nephropathy. So this is where the kidneys now is affected. And usually, guys, I didn't go into much of it, but what really happens again, if your blood is being concentrated with so much glucose, usually your glucose will never be filtered or would never go into your urine, right? Now, in the case of a diabetic, their urine would actually be sweet. Yeah, I know it sounds crazy, but it's true. All right, so what happens is that if you now are, if with all that heavy load of glucose that is coming in the blood and has been filtered by your kidneys, when your kidneys now cannot take on that load or that glucose load, what happens is that the kidneys eventually would say, look, we can't handle this. And what happens is that some glucose will pass through that filter. All right, they would slip through that area, and again, remember, it's glucose, it's sugar, so it's actually either going to be clumping along the actual filter, it's going to it's going to stay there, it's going to damage that filter that's supposed to protect and prevent other things from being filtered, and it goes straight into our urine. And that is why we find a lot of diabetics are having a lot of infections, because bacteria love sugar. right? Fungi, and so they love sugar. So if there's sugar and so in your urine, chances are you will have a lot of urinary infections. Okay, so if you were wondering about that, all right, because your urine is actually sweet. All right, so that is where we would have the damaging of the kidneys in the area in which the urine is filtered, and as a result, this will then lead to what we would call diabetic nephropathy. Right, and we talked about the eyes, we talked about the retinopathy, where there are going to be damage into the blood vessels, right, these tiny blood vessels that would leak fluid into the retina, and then we would have these cotton wool spots areas, and where this patient would then eventually complain about blurry vision, or actually seeing, like, sometimes they would talk about seeing like two images, or they're seeing certain things like actually spots when they look at an image. All right. Okay, so now we're coming down to the end of our presentation today. And just some simple little tips, guys. I hope that this evening session was beneficial to you. I hope that we can take some of the knowledge that we have learned today and incorporate it into our daily lifestyles. And also, we have a little bit more information. So when we also see our physician, we're somewhat equipped as to the things that we need to know, the things that we can ask. All right. And also, we ourselves in preventing the onset of diabetes, we're now aware of the little that we can do to help improve our lifestyle. So just some self-care tips for the diabetic. At the end of the day, we want to advise you, there are so many things what you can do. You can spend some time with your physician, and you can discuss some of the foods that you like when making a meal plan. Okay, so sometimes you can create a meal plan. Remember, it's not about what really you eat. Yes, you don't want to have all the cake, all the sugary foods and so on, but it's about how you eat it in terms of your managing your portions, and it's really in general the calorie intake. So there are some things for real you're trying to definitely not indulge in, but the goal is to eat and drink as healthy as possible. All right. You want to ensure that you get enough sleep. You want to ensure that you exercise regularly. If some of you cannot go to the gym, you want to at least you can do some walking based on where you stay. You can do little morning walks. You can do little morning jogs. Another thing that is really nice is dancing. Some people, dancing might not be stressful to them, so it's always good to do a little dancing. All right. A certain activities that you like. Some people like hash. Some people like doing hiking. So some of these, these things are really good to reduce stress. You want to be able to check your feet every day. Make sure you check that there's nothing there, no cracks. All right. What is really, really important, you want to keep track of your food. You want to make sure that you drink your water daily. You watch your sugar intake. Again, some people I wouldn't advise to be too much into your calorie counting, but you want to look at foods that definitely can give you enough energy and also are not in high concentration of carbohydrates, but they give enough energy, and they also burn sugars very well as well. Oh, what's hash? Okay, all right. So there's so many things I said, and the question is, what's hash? Okay, so hashing is like hiking, right? Yeah, so hashing is like hiking. That's this thing they do here in Grenada. So I'm sorry about that. All right, so it's hiking, a form of hiking. Yeah. Okay, so and try to reduce your stress intake. The stress levels, sorry. Try to reduce your stress levels. If there are things that you like to do, try to get them done, whether you want to play a sport, tennis, basketball, football. All right, go to the beach. These are little things that would also help reduce your stress levels. And those are some of the self-care that you can always follow. Okay. All right. So this is it, folks, for us this evening. Oh, you're welcome, Mommy Tammy. You're welcome. All right. So these are some of the tips, and this is diabetes type 2 and its effects. So again, guys, I'd just like to say thank you so much for all our listeners. Thank you for our viewers on YouTube, Facebook. Thank you for those that have been locked into 103.1 Hope FM. Again, I am your host, Dr. Zayniah Louison, and you are listening to Heavenly Medicine. Have a great evening. God bless. Stay healthy. Remember, your health is your wealth. Bless up. Good night.
to cry for help, you smile and drown it out. Only you know how it feels inside to try and try and try and try and try and fail. Only you know why you say the clock and he's not at home. Out with his boys drinking, 'cause he knows when he goes home and opens